Should be recording. Alex, are you seeing this in slideshow mode or no?
It is loading right now, but I believe we'll be able to see it. Yep, perfectly.
So it is in slideshow mode?
Yep, it's in slideshow mode.
Okay, let me add a few more people in. Okay, so great. So before we get started, a few housekeeping items. In the chat, feel free to chat with everyone. Feel free to put your contact information in the chat if you want to connect with others. If you have a question, please put it in the chat. We do have someone monitoring the chat, and we'll be addressing those questions and comments. Please stay muted during the presentation, and then unmute if you have any feedback or during the breakout room sessions. And camera. So we are recording right now. You may choose to turn your camera off at any time, but please do turn it back on in the breakout rooms. We will not be recording in the breakout rooms, but we will be taking notes and be sharing those notes in follow-up communication and as we wrap up today's event. So the agenda for today, I just have a few slides of latest news and announcements. We will then go into our partner presentations. We have 3 today from some of our DAISY partners who will share with you about their DAISY program. We'll then open it up for some question and answer. And then we'll go to our breakout rooms. So we have 3 breakout rooms today. Those are the topics. First-year programs are just getting started, best practices for existing programs, and expanding your program additional recognition. So you can pick one of the rooms to join. I understand if there's several rooms you want to join, but please know we will be taking great notes in those other rooms. And again, we will share the discussion with you as well. And then we'll all come back from our breakout rooms for the highlights from the breakout sessions, and then we'll do a summary and a closing. So a few news and announcements that we just want to make sure that you know. Ways to get all of our latest news. We do a quarterly update 4 times a year. Starting in January, that will actually go to a monthly update. So if you're not seeing our quarterly updates, please let us know. It's emailed to you. We also post it in the Resource Center, and we post it on social media. And it's a great way to know all of the latest news, announcements, updates that we have from DAISY. You can also check the latest news section of our website. And if you're on social media, please follow us. We always are posting news announcements, DAISY honoree stories, and lots of good content as well. All right. Just so you know, we have refreshed all of our marketing materials. So please check those out if you're looking to refresh any of your materials or need some ideas. All of this is available in the Resource Center. We do have our DAISY book now available as an audiobook. I know previously that was an issue with shipping for our regular book, but we do have an audiobook available now that Mark and Bonnie recorded. So if you are interested in that, please check it out. And let me see here. Just a few more slides and we'll get started. Reminding you all about the power of the nominee pins. This is a topic that comes up a lot. Just remembering that when a patient or family member or colleague nominates a nurse, that's recognition in of itself. So we hope that you are recognizing those nominees by giving them their nominee pin, giving them a copy of their nomination so they're getting that feedback. And then some organizations will also include a congratulations note from their manager or from their chief nurse. And one more topic that we've been hearing a lot lately for your consideration, and some of you may already be doing this, we call it closing the loop, and that's letting the nominator know that that nomination has been received. We'll get a lot of calls and emails from patients and families that say, I turned in a nomination, what happened to it? I never heard anything back. So thinking about a process where you can let them know that it has been received and what the next steps will be in the process, because they want to know that that nurse got their gratitude, their recognition, and their feedback. So once again, thank you all for joining us today. I'm excited for this event. I am now going to turn it over to Alex to take over the program and to introduce Carolyn Fox.
Hello, everyone. It is such a pleasure to see so many of our DAISY coordinators and DAISY team members here today. My name is Alex Schoen. I have the pleasure of working with all of you and your DAISY programs as your program director. I appreciate you participating in the event today. I hope you will find it beneficial as you share some of your best practices, learn from others as to what they're doing to have a strong and successful DAISY program. And we look forward to the conversations and meaningful discussions to come. We are first going to begin with our DAISY representative to Europe and the United Kingdom, Carolyn Fox. I have been working with Carolyn for the last year, and she is going to speak to the group today to kick off our event. So Carolyn, go right ahead.
Thank you very much. Thank you very much, Tina. It's really great to be here. So just to reiterate, I guess what everybody else has said, a really warm welcome to everybody and a huge shout out to our speakers, because of course, without you, we wouldn't be able to do today. So we hopefully have lots of DAISY partners. I can't see everybody that's on the call at the moment. And also I'm hoping that we've got a few potential DAISY partners joining us. I think this is going to be a really excellent conversation. And as Tina has already said, do take the opportunity to use the chat, because this is about really creating a social movement for DAISY across the United Kingdom. And you guys have so much knowledge and so much expertise, and we really want you to share that with each other. You can always offer help, support and advice. So for those of you that don't know me, I have already been introduced. As Alex said, I'm the representative for Europe and the United Kingdom for DAISY, and I've been in post just over a year now. So what I will often say to people is, obviously, Alex is there for lots of the day-to-day operational things, but actually, if you need somebody from a DAISY perspective to come to your organisation, to talk with your teams, to actually have a face-to-face conversation, then I'm your person, because it's far easier to get me from France to the United Kingdom or across Europe than it is perhaps to get some of our DAISY colleagues from the US. So please do take the opportunity. Alex will post my email details in the chat during the course of our session today. So I think it's really important for me to share just a few personal reflections, because I am the DAISY Europe and UK representative because I truly believe in the mission of DAISY, and it is so great to have you guys here today as people who also understand just how important meaningful recognition is, how important it is to create a culture of gratitude in your organisation, and how this can actually significantly change organisational culture. We often talk about the triangle in DAISY, but I'll often refer to it as the pillars. For me, the DAISY Award and the meaningful recognition, the pride in nursing through using a meaningful recognition award like DAISY, as we all know, has a significant impact on the honorees. I had the privilege of being at Nursing Live last week for 2 days. And I really thought how much things had moved forward in the last decade in the United Kingdom. If I had been at Nursing Live 10 years ago, I would not have been inundated by people coming to say hi, because one, they were a DAISY honoree. Two, they'd got DAISY in their organisation. Three, they were a nominee, or they just wanted to know more about the DAISY Award. I never expected so many people to come and say, hello, I'm an honoree. And the sense of pride that those individuals had because either they were an honoree, a nominee, or their organisation choose to recognise nurses and midwives with the DAISY Award was absolutely palpable. So never underestimate, and I'm sure you don't, the impact that meaningful recognition has on the teams and also on those honorees and the nominees. The nominees, I think, are just as proud, and I think it's really important, just to build on what Tina said, do make sure that your nominees get their nomination and also know that somebody has nominated them through the DAISY pin. I think over the last decade, I have certainly seen the Daisy Award and the Daisy Foundation change meaningful recognition in organisation, changing the culture and building a culture of meaningful recognition. And we know that this extends far beyond our nurses and our midwives. We know that organisations really sit up and take note because they use Daisy as a catalyst, and they use nursing and midwifery recognition as a catalyst to celebrate teams and to celebrate other professional groups within their organisation. And I'm sure we're going to hear some of that from our speakers today. And then the thing that I find really quite fascinating but incredibly moving as a nurse is the impact that the Daisy Award has on our patients' families and the people that choose to write the nominations. The impact is significant. There's some great research work going on at the moment, a qualitative study asking those nominators to tell us what it's like to be a nominator and what it actually means to them. But what we certainly know anecdotally is it gives our patients and those families opportunity for closure. It gives them the opportunity to write such a reflective piece about the care that they received. And I think as nurses, to give our patients and the families the opportunity to be able to do that through the Daisy Award is amazing. So, in conclusion from me, because Alex will tell me off, and those of you that know me know that I can talk for England, probably also Scotland, Wales and Northern Ireland. So my closing remarks are going to be, it's amazing to see so many of you here today sharing and learning with each other. I cannot believe where the Daisy Award is 10 years after, almost 10 years after its introduction into the United Kingdom. And what we must remember is it reconnects our nurses and our midwives to their purpose. It gives them a sense of pride. It changes organisational culture, and it has a significant impact on the honorees and their teams in terms of reminding them why they became nurses and midwives in the very beginning. So Alex, back over to you, and a world first and probably on time.
Thank you, Carolyn. You did wonderful. And you are absolutely on time. So thank you so much and for sharing that wonderful message with the group today. We are now going to move into our partner presentation session. So 3 existing Daisy partners have put together and spent time and dedicated their efforts to put together a review of their organization, their program, the successes and experience they've had with Daisy from implementation to where they are now, sharing some of the best practices or things they've found to be most successful through their efforts thus far. So we are going to begin with the presentation from NHS Grampian in Scotland. Caroline Reid and Jill Fairbrash are going to be our representatives today from NHS Grampian. Carolyn, can I hand it over to you to share your screen, please?
Thanks, Alex. Apologies, I thought you were sharing my screen, so
Oh,
that's
I
on
can.
me. Oh, can you? That would be great. If
Yeah,
that's okay, that would be
absolutely.
amazing. Thank you so much. Apologies, I hadn't ascertained that.
No,
So
that's okay.
just while Alex is doing that, hello everybody. My name is Caroline Reid, and I'm one of the clinical nurse managers in the Children's Hospital in Aberdeen. And I'm joined today by my colleague Jill Fairbrash, who I can't see on the screen, but I'll let Jill introduce herself if you're here, Jill.
Hi, thanks, Caroline. My name is Jill Fairbrash, and I am a facilitator within culture and wellbeing within NHS Grampian.
Thank you, Jill. So yeah, I'm delighted to be here today to talk about the Daisy Award in NHS Grampian, and I'll go to my next slide, please, Alex. So apologies, you probably all know this already, but I thought it might be helpful for me to give you a little bit of context about Aberdeen and where it is. So you can see the map of the UK on the left there, and NHS Grampian's illustrated in that white dot at the top northeast of Scotland. So we have a population of about 500,000 people in NHS Grampian, and we have about 5,200 nurses in our workforce. So I hope that gives you a little bit of context about the size of the area that I'm talking about and geographically where we are. And we have 17 hospitals in NHS Grampian. We'll have our large flagship hospital, but lots of other hospitals like the Children's Hospital and a mental health hospital and some rural hospitals as well. I've been explicit about the different portfolios that we have in NHS Grampian because this is how we've managed our DAISY Award scheme here. So we have 7 portfolios and they're divided into, as you can see, learning disability and mental health, women and children's, surgical and ICU specialities, medicine, and then we've got 3 community partnerships, so Aberdeen City and Aberdeenshire, which is more rural, and even more rural is the Murray Hospital Community Health Partnership. So we've divided our workforce into those 7 portfolios. And next slide, please, Alex. The team that managed the DAISY award here, I'm a lead for the awards and recognition, probably about 2 years before COVID, so maybe 2020. We had a presentation from a team that had been over to Australia actually, and they came back talking about DAISY, and we were completely inspired here in NHS Grampian. And my colleague Jill Fairbrash has joined us today, worked really closely with the foundation and brought DAISY to NHS Grampian. We have a lead nurse for excellence innovation, Joanne Grant, who line manages Kirsty Morris, our DAISY project administrator, who's supported by one of the other administrators as well. So really, we've probably got about a 0.6 full-time equivalent administration team that are doing all the hard work behind the scenes for DAISY, and myself and the other 3 lead on it. Thank you, Alex. So we launched DAISY in NHS Grampian on International Nurses Day in May 2023. We've got a rooftop garden here in our flagship hospital, so we were absolutely delighted to have a big DAISY celebration up there. As you can see, we went all things cinnamon buns and DAISY, and it was a beautiful day. We had our comms team around that, and they were really, really key in promoting DAISY's launch at that time. So that first year, from May to December 2023, we had 669 nominations across the organisation. The following year, we had just over 1,000, and to date, we've had almost 1,000 this year. So we get, and I'm not sure how much other centres get, but for us, that feels like a really high level of nominations for our registered nurses and midwives. The North East of Scotland is not known for being a loud and shouty kind of population. They're probably a bit more reserved. So to be honest, I was a little bit surprised that our communities have embraced it so much, but the public, like Caroline said earlier, the public absolutely love giving their nurses and midwives this feedback. And often if we, if there's been a delay of 2 or 3 weeks of that nurse actually getting their PIN badge, and the family's been able to see that on social media, we'll have families emailing saying, oh, I nominated my nurse 2 weeks ago and I haven't seen her on social media yet. I just want to check she's got it because I want her to know how much she means to me and things. So the public have absolutely embraced this here in Scotland. Next slide, please, Alex. So I think for us, promotion and public engagement, that has been so key to our success here. What we did in NHS Grampian is we found our DAISY champions, people that feel as passionately as Jill and I do about DAISY and rewards and recognition for staff. We went to our reached out to our 7 portfolios and asked for people to identify themselves as people that would take a lead in their own portfolio for it. That's been really important. So because it'd be harder for 1 or 2 people to lead it right across those 7 portfolios. So I've found champions in each of those portfolios. I think early engagement with our comms department was really key. They were so excited about it. I think it's an opportunity to publicise the great things NHS Grampian staff do all the time. So they were completely behind us. They were instrumental in doing our graphics and to launching us in social media on Facebook and Instagram. And I think that's been key to our success. We had great internal communications methods through our daily briefs and through line management structures, and just by Jill and I going out and meeting people and talking to leads in the organisation and trying to inspire them as much as we were inspired about rewards and recognition in DAISY. We had table toppers in all the public areas with the QR codes that people could scan while they were waiting and instantly do a nomination through their phones. We have posters using our local staff teams, so pictures of our local staff teams promoting DAISY, again with QR codes on them so people could scan them in lifts or in ward areas. And we made little business cards for our community nurse teams as well. So those patients that are cared for in their home settings probably wouldn't have access to those table toppers or posters, so that the community nurses can have little cards that they can leave in the patient's home. And also we encourage people to use email footers as well. So we've got a lot more virtual medicine now, and families get emails and information electronically. So email footers with QR codes or direct links for DAISY nominations too. We also had trifold forms, particularly in GP practices or where there might be older members of the population that might not be as comfortable with electronic ways of nominating, and those trifold forms come directly to me, and I would say we get about one every 2 months of a trifold form, so 99% of our nominations are electronic. I'm also really proud of the accessible version for mental health and learning disability teams that our colleagues have done, and if we can go to the next slide, I think I have a picture of that on there, Alex. So on the left-hand side of the screen, our nurse consultant in learning disabilities and mental health team has turned our DAISY paper DAISY form into an accessible format that's very graphic, very simple to use, and patients in that environment are supported to use these forms when they've wanted to make nominations. So we probably get about one form every 2 or 3 months using this accessible format. So really happy to share that with anybody, and I'm delighted that we've been able to incorporate that genre of patient. That's our poster that we made with two of our NHS Grampian nurses in it, and there was about 6 versions of that poster trying to capture teams from all across the different portfolios. Our little business card is next there, that people can leave in the house, and then we've got our table toppers as well, along with our email footers. So these have been our main ways of seeking nominations. Thank you, Alex. Social media has been absolutely key to our success. I can't thank our communications departments enough. We get extremely high activity on Facebook and Instagram. We regularly have over 50,000 views, which is almost 10 times any other post that NHS Grampian put on. The public absolutely love to see their nurses getting their nominations and their honorary presentations as well. It's a top performing content on social media, both monthly and annually, and DAISY posts in particular stand out as some of the most impactful. And I asked comms for some of our most successful posts, and you can see the number of views and reach and interactions on the numbers there. So it's absolutely phenomenal how much people are engaging with this. Alex. So as I said, most of our nominations come via the QR or direct link to our email. They all come directly into one NHS DAISY email account. Our administrator then blinds them and moves them into the shared email address with the individual folder for each portfolio. And each portfolio lead then can access her own folder and chooses their winner. So there's 7 folders with blinded nominations in them. So people from Children's Services access that folder, people from Mental Health access their folder, and so on. Each portfolio chooses 1 honoree a quarter, so there's a maximum of 20 honorees per year, and the administrator deals with any non-registered nominations that comes through and answers any queries. Every nurse or midwife that's nominated gets a certificate outlining the content of their nomination and gets a pin badge as well. And we're very deliberate in presenting the nominees as well as the honorees. We have somebody senior from the organisation go down to surprise the nominees in their place of work, and we gather a crowd around them and really celebrate nominees, of course, as well as we do honorees. The CNO presents as many colleagues as possible. It's a great opportunity for senior nurse visibility in the organisation, and for the if the consent is given, the nominator and patient and family is invited to attend the honorary presentations, and that's absolutely lovely. And I think the majority of honorees have had a family member attend. They get the pack that I'm sure you're familiar with the Healer's Touch statue in the folder and the certificate, and of course cinnamon buns for our team to share. We have now an agreement with a local baker that they will provide cinnamon buns and deliver them to the hospital for us. Pictures are taken for social media and on the daily hospital brief, and honorees are registered with the Daisy Foundation. Thank you, Alex. Our very first honoree was a midwife, and she was invited into a room to attend a big meeting, but of course that wasn't why we were all there. We were all there to present the very first Daisy honoree in NHS Grampian, and we were absolutely delighted that Melissa was visiting us so she could be part of our celebrations for our first honoree. So that was amazing timing, and we loved having Melissa there. And Juliet, the midwife there, the mum, and you can see she just delivered her baby about 2 weeks before, but she was delighted to come back and tell Juliet how much she'd meant to her and how well she'd looked after her during her stay. Thank you, Alex. So our top tips, I think, celebrate loud and proud. We love surprising our nurses and midwives at work to show them how what they do has been noticed and truly appreciated. Everybody that's nominated receives recognition. All registered staff receive their PIN badge and a certificate outlining their feedback. And if non-registered staff or students or anybody else receives a nomination, we make sure that they still get that feedback. It's passed to our sister recognition programme, the Star Award in NHS Grampian, or it's fed back via email directly to that member of staff with their manager as well, because it's so important that the families have taken time to give that recognition. So regardless who it's for, we make sure they get that in some way. My top tip is finding your Daisy champions, people that get as excited as Jill and I do in the organisation, that feel passionately about staff recognition, and that's been key to the success of our programme. And my last top tip, I think, would be to work really closely with our comms department. They are the key to our success, and that's what keeps it alive in our local communities without a shadow of a doubt. I speak really quickly, and I've probably got an accent as well, so I'm sorry about that. But has anybody got any questions around anything there?
Caroline, what we've been doing, so I know in the chat there have been a definite interest in the accessibility form that you have created. Anyone who has a question, if you want to put it in the chat, what we will do at the end of the presentations is we'll look at the whole list of all the questions asked. We'll talk about them as a group, and any ones that are specifically directed to each of our Daisy partners, we'll certainly allow them to address them themselves, if that's okay.
Thank you, Alex.
Perfect. Thank you so much, Caroline. It was a wonderful presentation.
Thank you.
Next, we are going to hear from Michael Underwood. He is our Daisy coordinator for Imperial, also a Daisy nurse leader honoree himself as well. And I am going to allow him to take the stage and provide his presentation on their success as well.
Thank you, Alex, and thanks, you,
Michael.
Caroline. Let me try and share. Is it working?
Yes, it is.
Hello. Can you see the screen?
Yes, we can see the screen. It's just not in the full slide. There we go.
Right,
now it's perfect.
All right, brilliant. Thank you. So, good afternoon. As Alex said, my name is Michael Underwood. I'm a senior nurse and Pathway to Excellence lead and the Daisy coordinator at Imperial College Healthcare. So, Imperial, we're a large academic teaching hospital in London. I do have a Yorkshire accent. I'm originally from the north, so we've got all accents on the call today. Imperial, we have 5 hospitals across 4 sites, and we've got numerous regional satellite units across northwest London. And just to give you an idea of our patients, we in 23-24 we delivered 1.37 million patient contacts. Within our organisation, we have around 6,000 nurses and midwives across our sites. And that's just some pictures of our hospitals all merged into one. So I just want to take this opportunity as well just to thank our Chief Executive, pictured on the left, Professor Tim Orchard, and our Chief Nurse, Dame Janice Sigsworth, because the Daisy Award has been a huge success, and it's been down to their kind of advocacy and leadership and going out there and helping give the Daisy honorees and nominees. So where our journey started, so in 2020, we were selected as one of 14 hospitals by the Chief Nursing Officer, then Ruth May of England, for the initial Pathway to Excellence rollout. And this is when I was kind of first introduced to the Daisy Foundation. And what I found and what we saw is that Daisy really aligned perfectly with the pathway standards of leadership, well-being, and that recognition element. And as everyone knows on this call, in 2020, the COVID pandemic hit. And we became, like many other organisations, a major responder to the pandemic. We had 185 ICU beds open at one point. Many of the staff, including myself, was redeployed. We had huge operational pressures. So this meant at that time we had to pause the rollout of Pathway and the rollout of the Daisy Awards. However, in 2020, when we'd got through that first big wave of the pandemic, our executive team, with communication with the nurses and the divisional directors of nursing, we thought these are two perfect programs that will help with our reset and recovery. So as you can see on the images there, this is when we was all wearing masks, going around and socializing Daisy and our little Daisy trolley there. So again, why Daisy? So as I said, it supported our Pathway to Excellence ambitions. And when we kind of was socializing with our direct care nurses and midwives, what recognition scheme would be meaningful to them, and what did they want involving them in the decision making? The majority of our staff really connected with the story and the impact of Daisy around the world, and they really valued that the nominations come directly from patients and families. And many of our nurses in London and across the UK, we recruit internationally, and a lot of our nurses knew about the Daisy Award from their home country. But it was also an excellent opportunity to showcase nursing and midwifery on that global stage. So I'm just going to talk about embedding Daisy into our culture in our large organisation. So we already had a really strong internal recognition scheme that was called Make a Difference. But through evaluation, and when I was looking at this, most of the nominations were staff on staff. So managers recognising their direct reports. And although patients and families and carers could nominate through this, it was very limited, the nominations that was coming through. And we also knew that patient gratitude existed. We knew from, and everyone will know on this call, when you walk around at the wards and the departments, you see notice boards with thank you cards, patients who have written letters, you see face-to-face thanks when patients are leaving. You also get your reviews on NHS Choices, and all social media, you get positive feedback. But there was never a really stringent process to give that thanks back to the nurses and celebrate it in a really meaningful way. And the Daisy Award kind of encapsulated all of that, with the Healer's Touch sculpture and the chief nurse being involved and the big celebration and promotion. So what we decided to do with the Daisy Award when we introduced it through the voice of our staff is, our staff really wanted to keep the Daisy Award exclusively for patients, relatives and their carers to nominate. And the benefit of that is it avoided a crossover with our internal recognition scheme, and it really ensured that Daisy highlights nursing and midwifery excellence from a patient and family-centred perspective. And also, again, it was a really good enabler to achieve Pathway to Excellence designation. So a little bit of promotion and awareness. You could do a million things around this, and I could have wrote like hundreds of slides around it, but I'm just going to stick to some of the core things that we've done. So the big thing, again, from that slide at the beginning, is engagement with your nursing and midwifery leaders and your direct care nurses, so everybody knows about it. And that's actually, sometimes it's not sending an email, it's not doing a screensaver, it's going and talking to those people on the floor. Also, the key thing is the collaboration with the communication team. That's been fundamental, because they will help give the visibility of Daisy internally and externally. So on our digital screens, we've got our Daisy posters, very simple, very effective with a QR code. We have these digital screens in all of our entrances, again, on all of our wards and departments have got these. We also have the paper nominations. So again, if people are not tech savvy or they prefer writing it on paper, we have that as well. And that QR code, when you scan it, it takes you to the external intranet page, and it's an MS form that feeds into a DAISY inbox. What we always do as well is we like to promote our nurses who become honorees. So our comms will write an article on the intranet, showcase the nurse, why they achieved the recognition. So on this picture here, we've got Sam, who was one of our recent honorees who provided end-of-life care, and Sam received 6 different nominations from every member of that family that she looked after. I think it's really important as well, and what's been a really success with this is working collaboratively and closely with our people and organisational development team, so HR team. So they're the team that run our internal recognition. And the whole point of us doing this is to create a culture of recognition, not a standalone initiative. And what we saw as well when we introduced the DAISY Award, and I think it's a bit like what Caroline said, you do get nominations coming through for doctors, radiographers, porters, cleaners. So we're able to funnel those through to our internal scheme. So it really has built that culture. Again, we, where appropriate, will invite the families to attend the ceremonies, and that creates a really personal, and the families really love that. On International Day of the Midwife, we had 3 midwives who was honorees, and we had the babies in, the grandmas in, the parents in, and when everyone was clapping and cheering, all the babies were screaming, but it was great. It was really good fun. And also about that kind of like the governance. So I do a quarterly report to our executive board so we can demonstrate the impact and the outcomes of the program, because ultimately they're the ones who are going to support it financially. A little bit more again about how we've kind of adapted and incorporated this into our strategy within the organisation. So in July this year, we launched our shared approach. So it's our nurse and midwifery strategy. We co-designed this with our direct care nurses and midwives. It's called Our Voice, Our Future, a shared approach. And we was able to use the pathway standards to help create this strategy. And what we did is we grouped the 6 standards together, and we've got wellbeing and professional development. And within this shared approach, it highlights how DAISY is a really, really important, DAISY under the recognition is a really important strategy for wellbeing. And we all know that evidence shows that meaningful recognition creates that positive practice environment. It supports staff retention, helps reduce sickness and burnout, and improves patient outcomes. Fairness and equity. So we give 28 DAISY awards every year, and everyone who is nominated, they receive a copy of their pin. They receive a copy of the nomination and a DAISY pin badge. We initially started giving 4 awards every 2 months. And in the first year, when we first started rolling this out, we were seeing about 10 to 15 nominations coming in per month, and that was steadily increasing. But after the first year, when we did like an evaluation, it became really evident, and from giving the honorees out, lots of our honorees was midwives, children's nurses, oncology nurses, CNS nurses, and we wasn't really seeing those direct care nurses working on the wards and departments becoming honorees. And when you actually think about it, when a mother has had a child, when the mother brings the small child in, or the oncology, these are patients that are at the beginning of life or at the end of life. Really important major life events are happening this time, and often they've got the time to complete the nomination and fill it in. So we saw this gap. So thinking of your elderly vulnerable patients who wasn't able to write a really in-depth nomination, or our ED patients who was critically unwell or in ICU. So to promote kind of fairness and equity, what our committee decided to do is, of the 4 awards, we would select one of those awards, and that would be where the midwives, the children's, the CNS and oncology would be eligible for that award. And the other 3 awards goes to the Band 5s, the Band 6 working day in, day out on those gastro awards, the elderly awards, the medical admissions, the EDs. So we kind of redesigned the process to ensure that every nurse had an equal and fair opportunity to be recognised. So going on to our celebration and impact, we aim to surprise all of our DAISY honorees on the ward. We do check in with the manager before, because sometimes there is some nurses who don't like that big element of surprise, or they might have some personal things going on, or they might have just had some well-being issues. So sometimes it can be a bit, oh my God, the chief nurse is here and there's a group of people, what's happening? So we always sense check that before we do that. Our chief nurse, Dame Janice Sigsworth, is present for about 90% of the awards. And as you say, going on to that ward, there is that surprise element, but it also kind of involves the whole MDT team and creates that power of meaningful recognition. And then the clinicians and the other people can get involved with eating cinnamon bun, which goes down really well. We also invite the nominator to come to the ceremonies on the wards, but sometimes that can be difficult, but we do get them when we can. And again, every DAISY nomination matters. So whether it's a sentence or a full page, we hold quarterly nominee ceremonies. So you can see from the bottom left. So we invite the nominees, we invite the ward managers, the matrons, the chief nurse, because some of the stories it's really sometimes difficult to choose the honoree, and some of the nominees are just as impactful. They're all impactful. So we want to take time to say thank you and celebrate them. We just think if a patient or family member has taken time to write a nomination, we owe it to our nurses to honour it properly. So I'm just going to talk a bit about our Pathway to Excellence experience and the DAISY, because we're kind of introducing these hand in hand. So looking at this chart, we started in 2022, and the orange one, you can see here, this is Charing Cross Hospital. So this is the line where we are pathway designated, and that is the site where we've got the most nominations coming through, and it's a continuous growth. We started on our journey, our second hospital, Hammersmith Hospital, in January of this year, and since we started doing pathway here and rolling it out, we can see the nominations have increased at the Hammersmith site. So what it's really showing to me is like nominations are increasing when staff are becoming engaged with the Pathway to Excellence framework and the culture of recognition. So higher DAISY nominations are reflecting greater staff engagement, an improvement of culture, and a stronger alignment with the pathway standards. So what we've decided to do, so we did give 4 every 2 months because of the increase and the logistics and the planning, the ceremonies. We've now changed that to present 6 every quarter. So that will help with that logistics. So the more that what we're seeing is the more we embed pathway within our organisation, the more our staff are feeling valued, and the DAISY nominations, the rise reflects a direct indicator of a culture change. And next, we're going to do our St Mary's site in Paddington. So that's the yellow line in January next year. So growing recognition and influence, many of our nurses have received over 5 nominations. So we've introduced this DAISY Chain Pin Badge. We've also introduced the DAISY Nurse Leader Award, which is a badge there. And I'm sure many of you will know on this call as well, a lot of external partners now are getting involved with DAISY and adopting it, and that's great. So we've seen the Florence Nightingale, one of our matrons, Taka was nominated, so that's Taka going to get her nomination and pin badge from Florence Nightingale Foundation. I think we were talking at the beginning of the RCNI conference recently, the footfall there for DAISY was like amazing. So what's really good and what's really nice is DAISY isn't just becoming, it's not just an internal recognition scheme, it's becoming part of our professional identity and influence in nursing and midwifery. So a little bit now for evidence for NMC revalidation, CQC. So DAISY nominations in our organisation written by patients, family and feedback. So that ticks off your NMC revalidation. Nurses can use that nomination as evidence. It demonstrates the impact what's having on patient care and professional values. They can include it in the reflective accounts and portfolios. Thinking about the CQC, because this is always on the back of our head, DAISY supports CQC inspections, evidence, it shows compassion, it shows patient-centered care into the caring domain, and it demonstrates a positive, well-led culture that values staff recognition. So for example, the CQC come in and ask, how many nominations have you got in this directorate or that ward? We can pull that from our database, and we also monitor that database every quarter with the steering group and looking at areas which might not be getting nominations. What is going on there? How can we improve that? My final slide, this is Inbal Bronzer. She's one of our senior nurses in ICU at Charing Cross. She's also a professional nurse advocate. She was an honorary a few months ago. So I just want to read this because I think it's quite impactful. So, my husband was a poet. When he was admitted to ICU after a massive stroke, Inbal didn't just care for him, she cared for who he was. She printed his poems and placed them around his bed so his words could surround him when he could no longer speak them. She guided our children with compassion, held us through heartbreak, and gave him dignity in his final days. Inbal didn't just care for a patient, she cared for our family and honoured his life. So, meaningful recognition, it's not a nice to have, it's a powerful driver of culture. DAISY helps us see the impact of nursing and midwifery through the eyes of our patients and families. It strengthened our Pathway to Excellence journey, creating a positive practice environment. As I said, it supports nurses with NMC revalidation and real evidence for CQC inspections. It enforces that every act of care matters, whether it's a sentence or a page. When we recognise our staff, engagement rises, intention improves, and patient outcomes benefit. So just a final word, DAISY reminds us what matters the most is how we make people feel, and it's the true measure of excellence in care. And that's me finished. Thank you.
Thank you, Michael. With all of the evidence you shared throughout the presentation, you really got us with the heartstrings at the end. That is a beautiful nomination story and a wonderful way to conclude. For any questions for Michael, like we spoke about after the first presentation, if you want to throw them in the chat, we have one final presentation today. We'll then do a main Q&A session and then have a brief amount of time for us to go into the breakout room for any further discussions or connection between DAISY coordinators. Our final presentation today is going to be from Anita Patel and Jane Martin. They are from Leicestershire Partnership NHS Trust and are going to speak about the success they have had with their program as well. Anita, can I pass it over to you now?
Thank you very much. I'll just share my presentation.
So thanks, Alice. We'll just introduce ourselves at the start, if that's okay. So I'm Jane Martin. I'm Assistant Director for Nursing and Quality at Leicestershire Partnership Trust and the lead for the DAISY Award. And I'm joined by Anita as well.
Yep, I'm Anita Patel, Project Officer for Professional Practice and also DAISY Coordinator.
Thanks, Anita. So our first slide just puts our organisation, gives you some context around our organisation. So we're a community and mental health trust, which is really pivotal in our DAISY journey, and we serve the population of approximately 1.1 million individuals in Leicester City, Leicestershire and Rutland. We employ registered nurses and registered nursing associates from all fields of practice. We do not provide midwifery services. We provide services from birth to the end of life from a multidisciplinary team. We do not provide acute physical health care, but we do provide in-reach or liaison services into GPs and acute physical health providers. We're a large geographical area, and it's both urban and rural areas, and we have a diverse patient and staff demographic. So as you'll see from our slide regarding our numbers, regarding our staffing, but it's about our community contacts. We provide services both within the community and within inpatient services, but our inpatient services are from sort of smaller hospitals that are quite spread across a large geographical area. So that's the background to our trust, and I'll hand over to Anita for the next slide.
Thank you very much. So we launched Daisy at International Nurses Day in May 2023. And we did look at starting a lot earlier, but due to COVID, we had to put it on hold. We currently get funding for Daisy through our charitable partners. Any nominations that we get that are not for other organisations, we forward on to the relevant parties. We make sure we get contact details for them. Those nominations that we receive that are not for qualified nurses, we send on for other LPT awards within our trust. And we do notify those individuals who those that aren't eligible for Daisy, we will,
It's all right, Anita. So those that aren't eligible for the Daisy criteria, we will forward the nomination on to that individual so that they can have that as part of their appraisal, and also their line manager as well, and part of their revalidation as well.
Shall I continue? Sorry about that.
Yeah, of course, it's okay.
We do an annual update at International Nurses Day, so we will showcase all of our award winners. Every 6 months we include our Daisy data in our staffing reports, and we also capture the EDI data for our honorees. So we started, like I said, back in June 2023, and till now we've had 25 Daisy winners. We've had 42 Daisy runner-ups. We've had 35 unqualified nominations, 3 AHP nominations, and 4 other nominations. I'll pass you back over to Jane now.
Thanks, Anita. So as a community and mental health trust, our journey's been a challenge at times. So I think the first point is about the community working, and we haven't got our community, our workforce under one roof or within big hospitals. So that's been a real challenge, is how we reach out to our patients and to their families in terms of how they can nominate. Also, we've had to do a lot of work on considering the needs of our patients as well, so particularly nominations from our patients that are receiving mental health services. We've had to put provision in place if that nomination is part of their presentation of their mental health. So at times we can have many nominations from the same patient that at times isn't easy to understand. So we just make sure that we've got it all set out so it's fair and equitable of how we support that, but then we revisit that nomination later on. We've had a lot of consideration regarding mental capacity as well, how we support, one of our colleagues mentioned this before, how we support those individuals with learning disabilities and individuals who are going through a mental health crisis in terms of those nomination stories as well. So we do a lot of work regarding that. I think it's fair to say we've learned initially when we started out our journey, we were there wasn't many mental health or community organisations that were part of the programme. So we've been able to develop our own terms and conditions as we've gone along in terms of who we accept nominations from and what we do in those tricky situations. Another hurdle is we do have quite detailed and sensitive nominations. They are immensely impactful, but we obviously monitor that, and we involve the nominator throughout the process in terms of the story that we give at the honoree presentations as well, but we involve them and get their consent in what we share. But they can be quite distressing and sensitive, but it really shows the journey of what our nurses have supported with our patients from periods of real despair and lack of hope to not needing mental health services anymore. And the most recent piece of work is about clarity and assurance regarding consent, and that is in terms of sharing those nomination stories, whether internally within the trust or more externally outside of the trust, and that even is in relation to what is put on the DAISY international page as well. We've now got that in hand regarding that consent, and we were supported that by our communications department as well. I think it's fair to say that we've been continually learning, and we still learn. There's not really many months that go by that we've not got a situation that we need to discuss, but key to it is that we keep it all on a crib sheet, so that we've got that constant historical memory there, but also that we're being fair and equitable in the months to come that might present a similar situation. So Anita's going to talk about how we gather and how we promote the DAISY Award.
Okay, so sorry, am I echoing?
No, you're fine.
Okay, that's fine. So as you can see, we've bullet pointed some of them, but I'm only going to touch upon some of them. So the main things that stand out are we link in with our chaplaincy service and our compliance team. So chaplaincy is a big thing for us because obviously they actually sit with the patient, they speak to the patient, they can physically talk to them about how to do a nomination and talk through our nurses. We've got links on our job pages and on our application form. So on all our job descriptions now, we actually put the DAISY logo on it. We have retention as an employee, so sorry, but we'll touch on that a bit more later. We attend a number of health and wellbeing roadshows and have a StaffNet page. We promote DAISY at the roadshows, and we speak to our DAISY, talk to staff about the DAISY Awards. We've also had some feedback from runners up about how they felt about getting the runners up at these roadshows. So it's been very positive. We've got a dedicated StaffNet page which shares all of our winners, all of our runners up, and also takes them to the nomination form. And a little bit of information about DAISY. Moving on to some of the new things that we've done. We've developed an LPT trifold leaflet, which includes quotes from our winners, how to nominate, and how to contact the DAISY team, as well as looking at a QR code for our DAISY page. We've developed the accessible guide and nomination forms for those who require that information. We work closely with our SALT team and one of our managers. We've also got linked in with our translation team who, if we need the leaflet or any of our resources in a different language, we work with them to get that developed. And we've also got an auto reply system where we contact every nominator with an update on their nomination via email and telephone. We also let them know if we forwarded on their nomination, and if they're outside of the LPT, we make sure we send it on to the correct provider. I'll go on to my next slide. Right. So I'm going to talk about our nomination process. So we plan all the panel dates in advance, a year in advance. So we'll make sure our panel knows when we've got the individual panel. So we do the individual panel in week 1 generally. We will have a group panel, which is already set in the diary. So the processes we do is obviously we get the nominations in. We will, sorry. We collect all the nominations on a master spreadsheet that would be either electronic nominations or paper nominations. We will do that at the end of each month. So on the first of the month, we would make sure we check all of them. We check if they are a staff member within our organisation. Then if they are, then we send it on to the HR team to check, and we check if they are registered or non-registered. We look at obtaining if their ethnicity and check if they're under any disciplinary or any HR investigations. Once those checks have been completed, we then send it on to our panel. The key thing to note about our panels, we have an EDI representative and we have a lived experience partner. So we have the same EDI representative at each panel. The patient with lived experience is different every month, but all nominations are anonymised, so anything that's notifiable, like where they work or if it's a he, she, that's all goes through at the panel. The panel will score the nominations, and at the end of it we will tally that up. Once we've totaled them up, if they've received over 75, then we class them as a winner. If it's under 75 totally, we send on for communications to consider for another award. Once we have our winner, we then start to look at sorting out the awards. As part of our matrix, we do incorporate our trust values.
Okay, thanks, Anita. So once we've identified an honoree, we then look at our presentation. So on the next slide, if that's okay. Like other people, they're arranged as a surprise. We use team meetings. And we do, as everybody else, cinnamon buns. We have a packet of daisy seeds as well that we give to individuals, so they'd be reminded of their daisy award over time. So that's been a new thing that we've instigated. We also started to get our executive board members to come along to the presentations. I'm a person that tends to present them because I think it's really important that our executives hear the actual nomination story. And like I've said before, we've confirmed and sorted out the consent forms and issues that we have. I think, like on the next slide, the nomination story, the feedback from our honorees is what's been key in terms of the success of the programme. We asked them to give feedback via a QR code because we found getting feedback from honorees at the time of the presentation was quite overwhelming. So they can fill that in a later date. But basically, as everybody else has mentioned, you know, it's about that overwhelmed feeling of pride, that really grateful for the nomination, special as it's from a patient, carer or family member. All of them talk about the team sport of nursing as well, and the difference and impact on individuals' lives that they've had, and about how it's reinvigorated their love of the profession and has a real retention element as well. So just to finish up, our top tips from our journey is that it's that importance of acknowledging all nominees, not just those who are nurses. So we do that through the various ways that we've talked about. We've produced and we maintain a guide and a crib sheet. That's been absolutely vital in terms of making sure that we're equitable going forward, but we've got that historic memory there for it if ever other people need to have it. Continual promotion when out and about and planned events. We continually learn and adapt. It's about being fair and equitable to all of our patients, no matter what their needs are. Engagement, involvement of our nominators, again, has been key in terms of the stories that we're telling, and the contacts and conversations we have with Alex have been absolutely vital, because we do present her with some very different and unique situations that we just want to test out with her. So that's us in a nutshell.
Wonderful. Thank you so much, Anita and Jane. I really appreciate you sharing your presentation today. We are going to move into the Q&A session. So there were 2 questions that came up in the chat. A lot of the chat has been wonderful feedback and suggestions and praise to our speakers today. But 2 questions that were in there before I open it up to anyone else who may want to ask a question in the moment was first, Caroline, for your presentation about NHS Grampian and how you recognize those who are nominated for DAISY that are non-nurses. You did already respond in the chat, but for the whole group, would you mind sharing a bit more about what you do and why you do it when someone is nominated that is a non-nurse or midwife?
Sure, Alex. So as I'm sure everybody else here would agree, it's really important to make sure that everybody that gets feedback and everybody that gets feedback gets to hear about that and gets to feel that. So we have a sister programme called the Star Award, but that's mainly about staff, nominating staff in NHS Grampian, but they very kindly process nominations that are not registered nurses or midwives, or sometimes we will send it direct to the recipient, give them we'll clean up the feedback and send it directly to them by email, but make sure we copy their manager in and very sensitively explain that unfortunately we can't recognise you through the DAISY Award, but we're delighted to share this amazing feedback with you and congratulations, and we've copied your manager in. So we have 2 mechanisms of doing it. It depends what the feedback's like really, but we make sure everybody gets that.
Thank you so much for answering that question. And then Anita and Jane, there were 2 specific questions so far from your presentation as well. The first was related to how you close the loop and what you've maybe found to help that process be a bit quicker, as it is time consuming to not only recognize all nominees, but also those letting everyone know that they were nominated. Have you found, Anita, with the auto reply you said you've implemented, or getting the information to the nominator, letting them know that you've received their nomination or that inviting them to the award, have you found any other or specific tricks or things that you would want to share in how you do it quickly?
It's just about doing that quick email transition and also giving them a call, because sometimes a voice on the phone is a lot more powerful than just receiving an email. So I try and do the phone call first, then try it again. And then if I'm really unsuccessful, then I'll do the email. But I'll always follow it with an email just in case, because sometimes people are overwhelmed at the time of what you're trying to say to them. So that's the only thing that I've done.
I think for us, Alex, we don't have lots and lots of nominations. That's been one of our challenges in terms of getting them nominations in, because of our patient cohort and our community-based service. So I should imagine that would be quite tricky, like for some of the colleagues that have talked earlier about the number of nominations. I think the auto reply was really important, that it actually acknowledges that you've submitted an online nomination, because as somebody that's nominated for somebody from a personal nature, I didn't get that feedback, so I didn't know that it actually had gone in. So I think that's made a big difference. And it's just having emails ready, like, because Anita's also organised, that can quickly be just sent off.
Perfect. Thank you. And Caroline, you raised your hand right as I was going to ask you as well. Do you want to share any specifics with the quantity of nominations you're getting, kind of for the betterment of the group in this regard?
So Jane, we also struggle a little bit from our mental health and learning disability services. That's the ones that we have lowest engagement in. But we also quite early on discovered we needed to do an automated reply just to say to people, thank you so much, your nomination's been received, but please note it can take a month or 4 to 6 weeks to process, but please look out on social media for your nurse receiving the recognition, because otherwise people were emailing us, kind of chasing us up a little bit. So I think that automated reply was really important for us as well.
Wonderful. Thank you.
I would add too, Alex, for people who, if they're getting nominations online, the auto reply, I love that. If you're getting paper nominations, a lot of times they'll give you your contact information, and that's where we also have a template in our resource center of an email that can go out. If it's not an auto, we can give you the template that you can still reach out to the nominator, just letting them know that it's been received and what the next steps are.
Okay, thank you, Tina. Before we transition into the breakout room sessions, are there any other questions people want to ask in the moment to our speakers, to those of us here from DAISY, just open to the group? Is there any other questions we can answer before we move into the smaller group session? Okay. Tina, if you wouldn't mind putting up this slide again for the breakout rooms. So for the next, for about 15 minutes, what we will do is anyone here can choose to go into one of our breakout room options. We are going to have 3 breakout rooms. We are also going to have DAISY representation in each room. To help facilitate the conversation, answer any questions from the DAISY perspective. But the purpose of these rooms is for you all to connect with one another. You can share your contact information in the chat, ask questions to each other about what's going well, or showcase your successes and programs, as many of you have been doing in the chat. The first room is going to be for any first year programs. So those who are just getting started with DAISY, maybe you haven't had your first celebration. Maybe you are here today because you're interested in implementing DAISY and you want to hear from others who've taken that plunge and adapted or created a partnership with us and are beginning to move forward. This is also a room that would be great for new DAISY coordinators as well. For the second room, it is going to be best practices. So this is just any existing DAISY partner wanting to talk about your success or ask others of your same status who are doing, if you're having any barriers, you want to ask how someone might have navigated something specific. This is a great room for you. New DAISY coordinators, you're also welcome here as well if you want to ask some more seasoned DAISY coordinators about their experience. And then room 3 is going to be about expanding your DAISY program. So opportunities to generate awareness and increase nominations are additional offerings like the Nurse Leader Award, the Team Award, Lifetime Achievement Award. So it will pop up on your screen. You can choose any of the 3 rooms you wish to attend. Like I said, we'll go in for about 15 minutes. We will then come back and do a report out for what we talked about in each room as a group so that everyone gets those details. We'll have a final opportunity for any questions and answers, and then we will close out the event for today.